First of all, I'd like to start by welcoming all of our listeners today to the Hope Piece Together podcast. As many of you may recognize, I'm Dr. Paul Raj Samuel, a local cardiologist who also serves on the board of directors, currently as vice chair at Mosaics. With me today is Dr. Elizabeth McIngvale. Some of you may recognize the name in general, but we are here talking to her today as the director of the OCD Institute. She is also, to her credit, founded the Peace of Mind Foundation. She currently works locally to help folks with significant OCD-related issues. And beyond our local community, also has reached out on a national stage to bring the dialogue regarding OCD and treatment as part of the larger discussion related to mental health in our world today. Thank you very much for joining us.
Thank you. So excited to be here and just really excited about the work Mosaics does in general and hoping that this podcast will help blend together because I know there's so much overlap. So excited to be here and excited to talk about mental health.
Fantastic. So I wanted to get started a little bit by taking a much bigger view of mental health overall.
Yeah.
I do not consider myself a mental health professional per se, but in my practice, issues related to mental health come up all the time.
For sure.
Especially
anxiety.
For sure. Yeah. Anxiety, depression, all of the ways in which those manifest in the body tend to overlap with cardiology a lot. So when I come to this discussion, I think it's fair for me to represent the viewpoint of someone a little bit more on the outside looking in regarding mental health diagnosis, and treatment. I think from the perspective that I bring and the perspective of a lot of us as clinicians outside the strict definition of mental health providers, I think a lot of us feel like dialogue related to mental health has really come into the spotlight in a way that wasn't the case even 7 to 10 years ago.
For sure.
I think there's been a tremendous amount of benefit to society as a whole, to individuals. But if there's anything that may have clouded the picture a little bit, would be that now mental health related concerns have entered the lexicon in such a pervasive fashion that although the attention and the concern blossoms to the benefit of everyone, I think, a lot of times definitions get lost and people start using terms or jargon that don't really apply. And although that can be helpful to raise awareness, a lot of times it can undermine the ability of folks to get the help they need, to get the diagnoses they need.
Yeah.
And I think if I were to make a list of the things that come up all the time, where maybe public perception disconnects a little bit from reality regarding mental health diagnosis, OCD would fly to the top of that list.
Totally.
It has become so common for anybody who just likes things a certain way or wants to stay organized. Suddenly they're getting labeled by all the folks around them as OCD. They're taking on those labels. I'm OCD. And although it's great that we have maybe a lower set point to detect folks in need of help, I think it can run the danger of undermining those who really need identification and treatment. So
for sure,
along that backdrop, perhaps you can just start getting us all on the same page. What is OCD? What is anxiety? How might that really look on a day-to-day fashion, and how it might differ from what we might commonly use?
Totally. And I'll actually start with, prior to that, just to kind of go into y'all's field a little bit more in the medical arena and healthcare specifically, you guys have been dealing with this much longer than us of just having Google, right?
For
of
sure.
so many patients coming in where they Google and they're like telling you their diagnosis and you're like, okay, can I run some tests or ask some questions?
For
and feeling like, all right, like there's benefit to knowledge, right? We all know that we want people to have knowledge. We want people to have information. But then the disservice is that a lot of times individuals can make up their own stories about what's going on.
Absolutely.
And as clinicians, we run into this battle all the time of, well, how do I believe you, right?
Yeah.
How do you know me better than I know myself?
Absolutely.
And so I think that there is this big piece where both diagnosing yourself has become a big issue. Social media has been incredible in stigma reduction, right? People are talking about mental health like they never did before, and they're putting faces to illnesses, which is amazing. At the same time, we have people that are watching a 30-second to 1-minute TikTok reel and coming in and telling us what an intrusive thought is, when I'm like, well, in the OCD lens, it's actually a little bit different. So To get to your answer for OCD, I love to kind of break it down to one slogan that actually we came up with through Peace of Mind years ago and put it all over shirts, which is OCD is not an adjective. And across the board, I think when people think of what is obsessive compulsive disorder, what is OCD, they're thinking of it as an adjective, right? Yeah. Oh, you should see my coworker's desk. She's so OCD.
Absolutely.
You should see my mother-in-law's kitchen. She's so OCD, right? You should see my husband's closet. He's so OCD. And the reality is that actually, we probably wouldn't diagnose any of those things as OCD because they're functional to those individuals. They might not be functional to the people that live with them, right? Like it's disruptive, it's annoying. Yeah. But for most people, they talk about it being useful for them. It's functional, right? We see surgeons actually talk all the time about when I'm in the OR, I want things handed to me a certain way. I have a certain system, right? Sure. But they talk about how it helps them function. It helps them have that sense of control in a high stress environment and situation and feel more functional. OCD is not functional. OCD is not helpful. And when we're talking about individuals dealing with OCD, none of the behaviors are enjoyable, pleasurable, or useful to them. So OCD is made up of obsessions, which are unwanted, intrusive thoughts. Yeah. Everyone has obsessions, right? You can love sports and love UT football and like obsess about UT football. And you might even have compulsions where you compulsively watch all the games or follow all the stats, but it's pleasurable. It's enjoyable. Maybe not when they're losing, but otherwise you enjoy it. And so it's not OCD, where OCD is unwanted intrusive thoughts followed by compulsions. And these are repetitive behaviors that are done in an attempt to get rid of that anxiety and distress that the obsession caused. So people have these unwanted thoughts. They don't like them. They hate them. They're brought on with a ton of anxiety and distress, and they start doing these repetitive behaviors or actions to try to get rid of it. Mm-hmm. Sometimes these behaviors are semi-rational. You're like, oh yeah, you think you're contaminated. You wash your hands. That kind of makes sense. Sometimes there's zero rationale, right? I have an intrusive thought and I go in and out of a doorway to make it go away. And you're like, how does that make sense? And so you can't really make sense of it. Logic doesn't work to treat OCD, but it is something that's really time consuming. Mm-hmm. So OCD, when untreated, always gets worse. Mm-hmm. And it's actually one of the top 10 reasons people file for disability across the world. So it's one of the most disabling illnesses, impacts over 3% of the population. So that's more than schizophrenia, a lot of your mood disorders, a lot of your major mental health disorders, and is very disruptive. And I think the biggest disservice, I think it's awesome that people know what the acronym OCD stands for. They didn't know that 10 or 20 years ago. Right. So there's benefit to that. I think the downside is most people think of it as just a quirk that a lot of people have and is not a big deal, and they don't understand the devastating nature it has on people's life.
So along those lines, certainly that's an incredible background. It's an incredible set of context for us to think about the behaviors we observe in ourselves or others. How has that disconnect between popular perception of what the acronym really means really influenced the way that the treatment patterns can be at times impaired? Across the board, right? I think two things. I think number one, I am actually seeing people with more severe OCD less likely to seek treatment because they're saying things like, oh, well, people think it's not a big deal. People won't understand me. People don't understand how severe this is. So I think there is this piece where it really devalues the impact it's having on someone's life, right? Mm-hmm. So they're not validated in their struggle because other people are talking about it in this helpful, good way when it's really actually so disruptive. And then I think the other side is that I do think, unfortunately, especially parents, when they see early signs and symptoms of anxiety or OCD, they will say things like, oh, well, they'll grow out of it. Right. Or, oh, this is a quirk, or, oh, this isn't a big deal. Yeah. And what I always tell parents is that if your gut is telling you something's off, something's different, seek treatment now. Yeah. I hear all the time, every day, right, from people saying, I wish I would have sought treatment earlier. I have never met someone who said, I wish we didn't seek treatment this early, of course.
But there's this belief of everybody has that. Everybody has their quirks, their tendencies. It's no big deal. Even when we know this is disruptive, this is dysfunctional, this is not helpful, and this is outside the norm.
Yeah, that makes a lot of sense. So speaking of definitions, certainly anxiety and OCD, tremendous amount of overlap. Yeah. That being said, not everyone with anxiety has OCD.
Totally.
Where are the ways that we can differentiate the two, and how has that come to be a factor in your practice?
Yeah, it's a great question. And we treat both, so anyone who treats OCD can treat anxiety because your OCD is like that subspecialty. But what we know is that it's actually quite an easy differentiator. Everybody has anxiety.
Yeah.
And 10 years ago, when I did public awareness talks, a lot of people didn't seem to understand what anxiety was. And I would have to explain, your heart races, your hair stands up on the back of your neck, your palms sweat. After COVID, I don't have to explain it.
Of course.
Right or wrong, everybody experienced it on a different level or witnessed people experiencing it. And so people get what anxiety is. But what the biggest differentiator between like general anxiety disorder and OCD is the content of the thoughts. Anxiety tends to be about more real world situations that are not really bizarre in nature, right? So things like, what if I lose my job? What if I get in a car accident? What if something happens at my kid's school today, right? These things that are normal fears that almost all of us have, but become disruptive, right? So individuals start not sending their kids to school or not going to work because they're afraid they're going to get in trouble, right? And so it becomes disruptive, but it's a normal fear. With OCD, the fears and content are bizarre. And the individuals with OCD know that. So like we know these intrusive thoughts don't make sense, right? So it's things like, if I touch this doorknob, what if I get a bloodborne illness?
Right.
They know you don't get bloodborne illnesses by touching a doorknob, but the anxiety and distress that is added onto that thought makes them say, but what if? Like, what if there's this tiny chance, and how can you guarantee that I won't, right? And it's like, well, I mean, I guess if somebody with an active cut touched it and had blood on the doorknob and you have a cut and touch it within a certain amount of time, like I guess there'd be some sort of risk. Never heard of that happening, but maybe, and so they're much more bizarre and different in nature, where anxiety thoughts tend to be more rooted in really like stress and worry that all of us have, right? Right now, I mean, we're a week out from the election. Everyone is stressed about the election, right? That's normal anxiety. And as it gets closer, it feels more heightened. It feels more stressful. Versus OCD might be something like, if I go through this doorway the wrong way, my mom might get in a car accident and die.
Right,
and you know it's not real, right? So this is what fascinates me about the disorder. And one of the reasons I really went into studying and treating it is because individuals with OCD have great insight.
Yes.
Like they know when they're not in the middle of a trigger, they can tell you like, I know this is irrational. I know this makes no sense, but I feel like I still have to do these behaviors to get rid of the anxiety.
Yeah. I think those are extremely helpful definitions, and I think do us a great service to understand the key components of them. Thank you very much. So along those lines, thinking through not just OCD, not just anxiety in a vacuum, but what this looks like in the real world. Yeah. I'm a clinician. I can treat heart attack without having had one. I can understand risks and benefits on an intellectual level without experiencing them on my own.
Sure.
That being said, the more that I can understand or connect to those disease processes from a personal level, either viewing them through the lens of the folks that I treat, understanding the impact on families by seeing the folks that are in the exam room or signing paperwork in the setting of an emergency as their loved one gets rushed away for a life-saving procedure, I can't necessarily connect to the things that I treat perhaps as directly as you connect to this specific set of disease processes. Sure. I've heard you speak in the past in very direct and very moving terms about what your personal journey looked like from starting and having early memories of really not being plagued by these types of intrusive thoughts, of living in a way that was observed by your family members and friends as being very similar to everyone else, to experiencing when that changed.
Yeah.
Say a little bit about how that transition took place and when you started to notice that something was a little bit different.
Yeah. I grew up really quite normal, whatever normal means, right?
I was trying to not say the word.
Who knows what that word means in art, right? But I mean, both my parents worked full time and, we were busy. I was a competitive gymnast, so I was really active in sports and school, but things were normal in the sense that I was functioning well. I had friends, I was doing decent academically, I did well in my sport, and there was really nothing that made my parents say something's different or something's going on. However, my parents will note now little quirks, right? That maybe back then they didn't really highlight, but examples were, so I tracked the weather and I would panic if there was like a tornado in Topeka. And I would tell my parents, you can't leave the house. And they're like, well, good thing we live in Texas. Like we're fine. Course. And the book Matilda, it was like a book I remember vividly wanting to read, but I would start at page 1 and I couldn't use a bookmark. I couldn't sit with the anxiety or idea of like starting in the middle versus starting at the beginning.
Yeah.
And so there were little things, but again, it wasn't really impacting my life, right? It wasn't disruptive. I was still functioning. So my parents didn't think much of it. And I always say the statement where I was fine until I wasn't fine. Right. And I mean that just because I don't think my parents would have done anything different, even knowing what they know now. I mean, sure, now they would have, but like back then there was nothing that was alarming to them to say like, we need to seek treatment. We need to get Liz help, because it was little things here and there. And honestly, I hid most of it, so I spent probably 6 months to a year between the ages of, 11 to 12 or so, hiding my symptoms. I was starting to do a lot of like a ton of hand washing compulsions, a lot of like prayer rituals and different things. But I knew they were weird. That's the thing with OCD.
Even young.
Yeah, this doesn't make sense. Like, you don't need to be doing it. And so I'd make up all these excuses. If I was going back because I wanted to like have a good thought when I went through a doorway, I would say something like, oh, sorry, I think I forgot something. Let me go grab it. Right. Just little things that no one really would have noticed because I was doing a great job at masking it. Yeah. And it all came to a front. I was 13. I had at this point, 12, maybe 12-ish, 12, 13. I was starting to do some behaviors that my mom was starting to pick up on. She was, extra hand washing, longer showers, and reassurance and things like that with her that she thought was a little bit bizarre. And we were going, actually, I was at John Cooper School, and we were going to Mo Ranch for like whatever you go there for. I don't.
For sure. Team building.
Team building.
Yes,
some sort of fun activity, right?
Yes.
In the 7th grade. And my sister was also at Cooper, and she was going on her trip to DC in 8th grade. And so that night, my mom had said I was going to go stay at a friend's house to go to Mo Ranch, and she'd take Laura to the airport. And I started like falling apart that night. I started saying things like, well, they put their dogs in a kennel. What if something happens to their dogs and they really only put them in the kennel because I'm there? Is that going to be my fault? And you think they're going to be upset with me? And like, what if I packed some of the same clothes she packed? Will she think I'm copying her? If I'm copying her, will she be mad at me? My mom talks about thinking this is strange, but then also thinking like, okay, well, you're going on a school trip. Maybe you're just anxious. Sure. And so my mom's answer was like, Liz, James will take you to school in the morning. My older brother could drive. So she was like, James will take you. Like, don't worry, you don't have to go to her house. Problem solved, right? Yeah. And so my brother takes me to school. This is back when we had CDs.
What's that again?
I know, right? And he is like, put the CD in, whatever. So I grab a CD and I start putting it in and out of the CD-ROM, and I start doing these weird behaviors. And then I start asking him all these questions. Like, do you think Laura will be safe in DC? Do you think they made it to the airport okay? Do you think everything will be fine? And my brother didn't know he was like 16, right? Sure. He had no idea what was happening. So he's just driving me to school. He's like, okay, bye. But my mom talks about it being such an important moment for her because my brother got home that day and he said, Mom, I don't know what's going on with Liz, but she was doing some really strange things. Like she was asking me all these weird questions and doing these repetitive behaviors. And my mom talks about that being the first time she felt validated in behaviors she had been seeing. You know, my dad worked so much, he wasn't home a lot. And so I hid most of the stuff from him. Yeah. And other people weren't seeing this. And so that was when my mom kind of had on her radar, okay, maybe there's something else going on. Like someone else is seeing it too. It isn't just me, like what's happening. And again, I was quickly becoming more dysfunctional, right? And not as productive or whatever you want to call it. And so my mom talks about coming to Cooper on Friday to pick me up from Mo Ranch, and that the second I got off the bus, she knew something was wrong. Yeah. And that was really the turning point for her. I'd probably lost like 5 or 10 pounds that week. It was a nightmare for a kid with undiagnosed OCD. So, cafeteria food, shared showers, like I didn't shower, I didn't eat, all the things happened in 1 week that again, I could mask at home, but I couldn't mask in this bigger environment or situation. Yeah. And so she talks about the second she saw me, she just had this pit in her stomach and knew something else was going on. This wasn't normal childhood.
So lots to unpack there, of course. And ultimately, the benefit of time, the benefit of your experience informs a lot of this. And tremendous benefit, I think, will come from us looking at it from both sides. So to start going back to Liz, the child, and then ultimately where we can land is Liz as a parent now looking through this and understanding your parents' perspective. You spoke very directly. You started to understand at some moment that there were behaviors in which you were engaging weren't inside sort of the normative set of things. That clearly was going on because you knew that it was time to start hiding these things.
Yep.
What do you think were the factors related to kind of making that transition? How did it make it aware that these were outside normal behaviors, and what did that do to you for feelings of isolation and
yeah, it was terrible. I mean, something's wrong because you go from pretty functional, like not doing these behaviors, to all of a sudden spending hours in the shower, doing these behaviors that you're like, I know this doesn't make sense. Like, what's happening? I always talk about this, but back then, I don't know if they still have DARE to kick drugs out of America. I don't
think we may have kicked DARE out of America.
I think we kicked DARE out of America because it wasn't useful, right?
Correct.
Or something like that. But we thought it was good when
Very
I was
much so.
at
Very
that
much
time.
So. Yeah.
And I always was so shocked that like we're learning about drugs and alcohol and sex education, but we're not talking about what often leads to those risky behaviors.
Absolutely.
Right? Nobody had ever talked about mental health.
Yeah.
I had never heard about mental health at this point in my life. Like no one in my household.
Yeah.
And by the way, I unpacked years later about my grandmother's like long history with depression in and out of psych hospitals.
Yeah.
But my dad never talked about that. He didn't share that with us, right?
Not.
You didn't hear about it in schools. And so there was, you knew something was wrong, but it was like, well, who am I going to talk to about this? But also like, I feel even crazier because nobody else is experiencing this, right? That's what I thought. Of course, I know that wasn't true because many other people had their own struggles, but no one was talking about mental health. Nobody was using acronyms, speaking about it. In fact, when I first started exhibiting symptoms, and my mom talked to a few people because she would call a few friends to say, this is happening. Can someone help me?
Right.
Everybody jumped to like, oh, this is early signs of schizophrenia.
Interesting.
Oh, this is a severe mental illness. And she was like, okay, well, what do I do?
Now
right.
What?
She didn't know. She was just like, all
How
right.
would she?
But no one knew what OCD was back then. No one knew how to
Definitely
diagnose
not.
specific anxiety disorders. And so I knew for a while this was weird, that there was some strange things going on, but I didn't have anyone to talk to about it.
Yeah.
And when we got home from Mo Ranch, that was really like the changing time in my life. I'll never forget. I was a mess at that point. Like the week of not eating, emotional distress, physical, all of the above. When I got home that night, I'll never forget. I was sitting on my floor with my mom and I was like in a ball crying. I was having a panic attack. And I said to her, please just don't make me go back to school.
Yeah.
And my mom was like, this is so like school. You don't
make sense.
Yeah, it doesn't make sense. Like you do good at school. What do you mean? Right. And so her answer though, which was so great as a parent, was I'll let you skip school if you tell me what's going on.
Yeah.
Because if you tell me what's going on, we can start to get you some help,
Absolutely.
but if you don't tell me what's going on, Liz, like you got to go to school.
Right.
I can't help you. Like we can't make changes. And I remember saying to her, I don't know what the word ritual actually means, but it makes sense for what I feel like I'm doing. I feel like I was like, I have all these horrible thoughts that are scary thoughts that like, you're going to die or something's going to happen to y'all. And if I don't do these rituals, I think it'll come true.
Yeah.
And my mom tried to use logic as any parent would.
Course.
She's like, well, Liz, that's not true. I was like, no, I know it's not true, but I can't shake the feelings. And so I knew for a little while this was strange, this was weird, but I didn't know who to talk to about it. And I think that once it became, this kind of like you're functioning, and then boom, you're not.
Yeah.
It does open the door for conversations. And parents at that point are like intervening, right? Because they're like, what's happening?
Yeah. So then the other side of the coin, now you've seen it sort of from both sides, not just through your own personal experience with this disease, but also being a parent yourself.
Yes.
So I think a lot of us go to the exact method that your mom used. Yeah. I can say that as someone very involved in the lives of their children, when I see something, and my wife kind of jokes with me or makes fun of me for this a little bit. I have my very short list of moms that I will go to and feel comfortable saying, honestly, hey, I'm seeing this. What are you seeing? What do you think? Do you have this problem?
Yeah.
I think we all kind of think through those ideas and those questions, and we lean on that kind of close circle of folks whose opinion they really value.
Yeah.
Now that you've seen it through your mother's eyes, has she told you a little bit more about what did that feel like? What did that isolation kind of look like? Here she is being fed the absolute 110% wrong diagnosis with nowhere else to turn.
It was horrible for my mom.
Yeah.
my dad, well-meaning, right? And love my dad. But when she first went to my dad and was telling him what was happening, my dad's answer was like, Linda, maybe you should see a therapist. And my mom was like, okay, why? Like, you know, she's like, okay, like
ready
for
to try
what?
anything. Yeah.
And he was like, because like Liz is fine. Like I see her and she's fine.
Yeah.
And it was so hard for my mom because I hid so many of my behaviors around other people, but I felt safe and comfortable with her that I like kind of threw it all on her, right? She was the recipient of all the anxiety, all the distress. And so I think for her, there was this really hard piece of like, she saw it, but other people didn't. And so she's trying to explain it verbally, but no one has actually seen it behaviorally, right? Except her. So she talks about it being just super isolating. Right. And it wasn't just that people were giving these scary or extreme, you know, diagnoses. It was that no one was telling her what to do about it. Right. You know, people would say, oh, it could be this, it could be that. She talks about how someone like dropped off a brain surgery article like within the first week. And she was like, okay, like I don't even have a diagnosis yet. For sure. And we're talking about like brain surgery for my kid. Like I know you're well-meaning, but this is strange, you know? Yeah. And, you know, so I think it was really hard for her, but I think it became harder actually, because what happened is grew up in Houston, largest medical center in the world, right? You're going to assume that you can get treatment easily, right? You'll be able to get a diagnosis and get treatment. And I will say we got pretty lucky. I got a good diagnosis. It probably took just like a few months to get a good diagnosis because a lot of my symptoms were very common OCD. Some were not, but some hand washing, certain things, it was easy for someone to say, I think this looks like OCD. Right. The problem is we didn't have good providers in Houston back then. And so we had a diagnosis, but we had no path to treatment. And that is unfortunately the bottleneck where most people with mental illness end up. Is sometimes they will get the diagnosis or someone will hear or know of their diagnosis, even if it's not them, but there is not a path to appropriate treatment. And so they just start to feel so hopeless, not just the individual, but the entire system, the family members, the friends, everybody who's involved.
Yeah. Must have been quite isolating, in fact.
Totally.
So thinking through that, I think we all, as parents, have these times where something is going on, we sense it. Yeah. And yet we don't totally know what's the story, what's the next move, what do I do with this information? What do you say to these parents, specifically if they start to think that perhaps their child may be on the pathway of the things that you went through? Yeah.
I mean, some of my statements are blunt, so I'll just share that.
No problem.
You know, like I like to just be cautious going down rabbit holes. I think so many people get pulled into this microbiome and, you know, all these what I would call mental health rabbit holes, which again, may be connected. Like I'm not debating that there probably is a lot of validity and usefulness for us to think about taking care of ourselves and eating well and exercising, but it isn't going to fix a mental health diagnosis. You need to have evidence-based treatment. And so the biggest thing I tell people is I need you to get a great assessment to get a diagnosis. That's number one.
And what does that look like?
Yeah. So great question, because people want to know this all the time too. Get a full psychological assessment. Okay. If you live in Houston and you have a kid, take them to Texas Children's, right? Like, but there's a lot of places that can do that, but you want to do what's called a full psychological assessment. And this is going to be where we're going to be administering a large battery, a huge number of tests and measures to understand what exactly is going on, right? Sometimes kids can look like it's ADHD, but it's really OCD. Can look like OCD and it's really autism, right? Like we need to really understand what's going on because we don't want to treat it inappropriately. And then the second is whatever that diagnosis, or if there's multiple, whatever is going on, remembering that it can be treated, but it needs an evidence-based intervention. And people get so confused about this, right? And of course they do, because they don't know what that is, right? Like, what does that mean? What does that look like? Right. You can go to the American Psychological Association. You can go to most diagnoses have their own organization. Like for OCD, it's the International OCD Foundation. For anxiety, there's the Anxiety Disorders Association of America. And you go to these websites and you look up treatment, like what we would call treatment protocols, right? But whatever it's called, typically there's a scientific advisory board associated that oversees and is updating this frequently, where you can know, okay, I have OCD. This is the evidence-based treatment, which is exposure and response prevention. I have trauma. These are the 3 evidence-based interventions, right? Which are cognitive processing therapy, prolonged exposure, EMDR, right? So every disorder has specific interventions that we know work.
So when I think through what you're saying, I think you and I, again, both clinicians working in different fields.
Yeah.
When I think about cardiology, when I think about other fields, obstetrics, mental health, there's always going to be a subset of folks who hear your discussion about evidence-based
Yes.
or science, any of these kinds of words, and immediately will go to a place of thinking about how that's them and that's them against us.
Yes.
And they are doing these things, hiding the truth. They are profiteering.
Right.
I know this comes up in my field.
Yeah. Why should they trust us?
For
Right.
sure.
They're skeptical, and that's fair.
Exactly. And many times this becomes the conflict between offering folks treatment or options that maybe they don't understand completely because they haven't had the opportunity to read and evaluate, or that we as clinicians, quite frankly, haven't done a good job expressing to them what complex solutions can look like in simple terms.
Yep.
How does this affect your day-to-day as we see folks every day going, like you said, down a rabbit hole, clinging to something that may be a simple nutritional change or an herb or something that's very easy to wrap their mind around, instead of accepting that perhaps there are challenging and complex situations that need to be brought to bear?
Specialized care. Yeah. I think, I am in a place where I feel like I'm lucky enough that when people come to our clinic, they've typically tried other stuff.
Yes.
And it hasn't worked. Okay. And so, right or wrong, I talk to them about that, right? That you're here because what you've been doing isn't working. Yeah. If it has been working, you're not showing up here.
Right.
And so people understand that. But what I've learned is that I actually don't get into debate. I get into education.
That
So
makes sense.
I'm much more like a believer of I'm going to provide psychoed. I'm going to give you the information, but you need to digest it. And I will tell people, even if they want to do our treatment and nothing else, of course it makes sense to be skeptical. I'm going to ask you to face your fears, to deal with anxiety, to do things you've been avoiding for a long time. And if you don't trust your treatment team, we're not going to have good outcomes. I can guarantee that, right? So if you are doing what we're telling you, but you actually don't believe in it, or you're doing it with hesitation, or you're kind of halfway doing it and you're skeptical of us or what we're saying, we aren't going to get anywhere. So I would much rather us have a safe place where we can have a conversation about that and we can talk about it, and that'll allow us to move through it. But I've had a couple patients, I think 2 ever, that tried alternative treatments, and I didn't hear as much from. I heard later when it wasn't working, that, here and there, and then they ended up seeking different treatment. But typically people will, even if they're trying that route, they are hearing you because it isn't working, right?
Yeah,
or at least it's not working significantly. So they might continue to do that on the side, which again, if it's making you healthier, great. By all means, if you're eating healthier, you're exercising, that's going to help your mental health, but it's not going to help your OCD.
Yeah. Certainly, and you touched on it a little bit, I know that from experience in my field, there are times where we sort of benefit in some ways from being able to measure things directly, quantify with numbers. I can give some measurement of how blocked something is or what level something is in someone's blood. And people
do
understand.
An EKG, show them the results.
Yeah, exactly. People understand, well, just numbers, it should be here, but it's here.
Right.
You don't always have the luxury to lean on those metrics.
Yeah, a little bit. So we use the Yale Brown Obsessive Compulsive Scale. It's a 10-item, super validated measure for OCD. And it helps people see what range they're in. So it at least will tell you mild, moderate, severe, extreme. And it'll allow us to say, hey, listen, you're at this level. Outpatient isn't going to work. Self-help isn't going to work. This is what you need. And we should be continuing to assess that to make sure this levels are going down, right? People are getting better. And most mental health conditions do have really good validated measures, but a lot of people, a ton of clinicians do not use them at all.
Yeah, that certainly speaks to the disconnect between evaluating the appropriate resources and just, going with whatever you can find because it's easiest to locate.
Totally.
So speaking of rabbit holes, speaking of something you touched on earlier, I think one of the biggest things affecting health and every other aspect of society revolves around social media.
Yeah.
And I think, interestingly, earlier when we talked about OCD and mental health in general, you did praise social media for its ability to do things like raise awareness, get people asking questions.
Some stigma reduction. Yeah.
Stigma reduction. There, no one is here, at least in this conversation, to fully vilify. Yeah. However, when we think about the other things that come along with it, the Pandora's box once opened, certainly there's a lot to be said. And I think we're just getting to the tip of the iceberg on data to look at what to do with social media, particularly when we think about young people.
Kids, yeah.
Unifying that with OCD, with anxiety, particularly, perhaps, how has social media really changed the landscape of the types of folks you see, the type of treatment that needs to get done, and the ability to achieve those goals?
Yeah, I mean, it's a great question because I hate social media.
Okay, well, there you go.
And I use it, right? But the comparison trap, the increase in anxiety, perfectionism, right? Now, all of a sudden, your friends get into college, they're hearing about it, they're posting about it in real time. You find out in 30 seconds compared to talking about it. Maybe they wouldn't even share that in a public forum.
Yeah.
Everything is in people's face, right? So that anxiety, that pressure, that comparison that people feel that increases anxiety as a whole for young adults, but also certainly for kids and adolescents, it's just so much more prominent than it's ever been before. So I think there's, of course, benefits to social media. I think the downside, which is the biggest downside outside of that, is that we know as human beings, we need connection.
Absolutely.
And social media has provided this false sense of connection, right?
Yeah.
People feel that posting or that responding or whatever, I'm connecting to someone.
Yeah.
But you're not. It doesn't have the same impact as a face-to-face connection. And we know that from a mental health and biological and all that perspective. And so I think that social media has really allowed people with depression, especially in mental health, issues, to become more isolated, to feel more disconnected, and that comparison, right? So you already weren't feeling great if you found out 2 weeks later that your friends went to an event you weren't invited to.
Yeah.
But now on social media, you see it in real time, 5 or 10 times a day, all the things your friends are doing that you wouldn't have even expected to be invited to. But now that you see it, it doesn't feel good.
Yeah.
So I think that there's a lot to be said about the way it impacts, but at the same time, that doesn't mean you totally shelter your kids from it, because we can't create a world where we're never triggered or where we never experience anxiety.
Yeah.
However, the way it's in people's face is different than it's been before.
For sure. So along those lines, just like with anything with the power to wield negative or even devastating public health consequences, some, including our current Surgeon General, advocate for warnings, literally warnings, to be put on social media, analogous to the days of when we first
put warnings on cigarettes.
Exactly. Warnings on cigarettes, warnings on bottles of alcohol.
Yeah.
Now, some of that, of course, gets a little bit easier when you talk about things like cigarettes and alcohol, because even at the time, general consensus aimed to block not just consumption, but really more purchase and acquiring of these substances.
Right.
Current political climate, current standards, if you can call them that, do not really create an analogous situation. Folks,
no, in fact, they profitize on it.
Absolutely.
Right?
12-year-olds can go online and click a button affirming that they're old enough to do something, and they're, ready to go.
Totally.
So how do we think of this in a different way, not just drawing from our experience of generations of parenting, thinking, well, something might happen here and we're just going to go with our instinct. We're just going to say, don't touch the fire, don't put your hand on the burning stove. But in a society where so much of our culture, so much of our even educational and recreational outlets rest on maybe not social media, but technology, the internet, et cetera. How do we kind of unwind those things and protect those who can't protect themselves?
Yeah, that's the biggest piece, is that I think a lot of us forget that it is our job to protect minors and that they can't protect themselves. I think that so many minors, because of social media, have started to create this like independent living that I shouldn't be told what to do, or I shouldn't have boundaries because you can give me a boundary, but I still have my phone.
Of course.
And it is so important for us to remember that actually they need boundaries, and it is our job to both protect them, but also keep them away from things that are dangerous. It's important to remember that children do not have the same impulse control that adults have, right? Children don't have the same ability to know, okay, I'm going to get to watch 5 minutes of TV and I need to walk away so I'm not late. That's not easy, right? It's very hard for them to walk away and disengage. And so I do think it's important in your households and in your family to decide what is your norm, and to stick with that and to be strict about it. Even if it feels cruel at times, your kids will thank you later. Yeah. The second piece is to remember social media is not relational. So the more we engage in social media, like a lot of us, I think, who don't feel as disrupted by it, we formed healthy relationships without social media.
Right.
So we already know, like, none of us are replacing relationships with social media. We're still engaging socially and doing those things. Social media tends to be our way to like veg out at night do this instead of I read a book, I'd go on social or whatever. These children, it's replacing their connection. It's replacing these critical skills that they have to develop. And for anxiety, it is so problematic, right? When we see the Surgeon General's report about mental health, depression, anxiety being higher than it's ever been in young adults, and we've seen increase in suicide rates and other things, we have to wake up and say what's happening. And part of that, in my opinion, is that social media has allowed us to isolate. It's also allowed our kids to not have to experience difficult things. You know, team sports are amazing for kids. They learn how to negotiate. They learn winning and losing. They learn how to work hard, how to keep trying for something, and we want those skills to be developed when someone is young and developed over time.
For sure.
And unfortunately, a lot of methods, whether it's social media, whatever it is, it becomes really disruptive. It becomes unhealthy. And so I do think you're seeing a stance, you know, for many people, if you have or haven't, The Anxious Generation is an incredible book to read. And it really helps us see the impact it's having, right? Play-based learning has almost been eliminated because of iPads and social media. And there's a lot of danger to that. And we're seeing that unfold in a scary way.
Yeah. And you brought up the book specifically. I think one of the things that makes a lot of sense within the context of this discussion is this concept from that book of communities where we place our children and they have a high bar for entry, but they also may have a very high bar for exit.
That's right.
So comparing sibling relationships or family relationships, or even you brought up team sports, the other teammates that live in the same community, this differentiates itself extremely starkly from an online community where you can leave a comment and vanish into thin air.
That's right.
And the consequences of that comment not only affect the recipient, but also the person putting it out there. When we think about these things, I think for sure these influence and exacerbate anxiety. If there's anything we can take from this, though, on a more hopeful note related to this, social media can be used as a tool, just like any tool can be used correctly or incorrectly. What are future directions that you see for social media as a way rather to not divide or exacerbate us in the situations we feel related to our illness, but to unify, to bring us together, to educate?
I mean, I hope, I mean, my goal would be that social media can become an effective education platform. You know, it has the opportunity to be able to educate millions of people on OCD specifically, on anxiety specifically, on treatments that work. And instead, though, because there is no regulation, which again, that's the tough part, is like, how do you regulate? But then by not regulating, right? I always talk about this. I've been doing advocacy for 20 years. And I've not been a clinician for 20 years yet, but close to it. My advocacy before I was a clinician was kind of scary. Like it was fine. I didn't actually give bad advice, but I wasn't a clinician. And people were relying on me to tell them what to do, to tell them what sort of treatment they should engage in. And the reality is like, I didn't have that. I had personal experience, but I didn't have the education and background to really be able to back that up. And so that's the danger of social media, is that lived experience is so valuable, but it is not the same as clinical experience, right? I don't want, like, I always tell people when they'll say things like, but don't you think I need to see a provider with OCD? I'll say, no, you need to see a provider who has trained in OCD and who knows how to treat OCD. My provider who saved my life didn't have OCD. And they'll say, but Liz, I say, if you have cancer, do you go seek out an oncologist who has a lived experience with your diagnosis? Or are you seeking out an oncologist who has training and background that warrants them being able to help you?
Absolutely.
We should not treat the brain different than the body. And so I'm hoping that as we continue to understand that and hear that, we can see the same thing happen on social media. You know, but I'll give a quick OCD example. There's I forgot his name, but he's a super popular author that focuses a lot on like celery juice being the cure for
yes.
medical and all sorts of things.
I have been presented with the celery juice argument.
Yes. And he did a post on how it cures OCD. And it was just so hard to watch because there are so many vulnerable individuals who are not accessing platforms of individuals who are actually providing good, appropriate, education. And, and so there's just so much damage that can be done that it's tough though. How do you regulate it? But I think the goal for me is that social media could be a great education platform.
Yeah.
It can lead people to treatment. And I think more than anything, what we are seeing happen is it is destigmatizing mental health.
Absolutely.
And more people are willing to talk about mental illness, to seek appropriate treatment because of social media, in my opinion, than ever before.
Yeah, that's really helpful. I think just like with any kind of crisis, the first step of moving forward is recognizing the
100%.
crisis. And I think we can gain some measure of hope for the future, thinking that maybe in 5 years or 10 years, we can look back on this moment as the time that we all realized the crisis and started to wake up towards what we needed to move forward in a healthy way.
I hope so. And I think we're getting there. I think the recognition broadly is much greater than it was 5 years ago. And part of that, like you said, is because we have data now to back it up.
For sure. So time continues to fly by here, and I feel like we could keep talking for hours, but that's probably not in our best interest. So in closing, certainly at Mosaics, we entitle our podcast Stories of Hope, because in crisis, in the worst moments of an individual's life, we always want them to think about the possibility of a new day, a brighter tomorrow.
Right.
I personally live my own life trying to think about how I want to be able to say that my best days, for example, lay ahead. As you think through the lessons from, as you say, maybe not 20 years of clinical experience, but 20 plus years of advocacy and of experiencing the ups and downs of mental health treatment, of healing and relapse, of improvement and stepping backward, of looking at treatments that have really changed your life and the lives of countless others. What kind of message of hope would you like to provide at this moment?
Yeah, I think it's so important because so many of us, including myself, right, will talk about our story, and a lot of the part that tends to be compelling is the difficult part, right? That's when people get kind of pulled in of like, wow, you were really struggling. I mean, I was taking 6 to 8 hour showers. It was totally unfunctional. I had dropped out of school at the time, and help and hope are always available. And I always tell people that even when it feels like that doesn't exist anymore, I hope that there's an advocate or somebody who's reminding you that it does. Yeah. Because for so many of us, when we're in the midst of a mental health journey, we can't hold on to hope for ourselves. Yeah. Someone else is holding on to that for us. Maybe it's an organization like Mosaics. Maybe it's an individual. Maybe it's your clinician. And we know that treatment works. That is what's so incredible, is that mental health and mental illness all have effective treatments, and they're actually super effective, right? Yeah. Whether it's medication, whether it's behavioral interventions or a combination, it depends on the diagnosis. The interventions are really, really useful. And if you're able to get to the right ones, which I know that's the hardest part, right? Is getting people to the right treatment. Yeah. We know that treatment not only works, but can change and save your life. And I always tell people that I really do believe that you learn your strength through your struggles. And you learn that when your struggle turns into something that you're not necessarily, I'm not proud of having OCD, but I am proud of the way I've moved through it and the impact it's had on my life and the work I can do now because of it. And I hope other people know that that same possibility is ahead for them. Yeah.
And certainly from an organizational perspective, we feel like we exist for the purpose of trying to focus people on solutions that can help them in the long term.
That's right.
On moving through, or at least if we have to be creative, around barriers to access.
Yep.
And ultimately, probably no better way to say it than what you just did. Treatment works.
Yep.
And for those out there struggling, for those out there that can't see a pathway to a better life, anything we can do to put forth that message, treatment works, get help when you need it, I think that's kind of what we're here to do.
100%. And what I always tell people is I've yet to ever work with someone that treatment didn't work as a whole, right? There was something going on. If treatment wasn't working, maybe we were engaging 1 foot in, 1 foot out.
Yeah.
If treatment wasn't working, maybe we actually had the wrong diagnosis and we needed a different treatment, right? If treatment wasn't working, maybe we weren't getting evidence-based treatment. But oftentimes the first treatment doesn't work because we know with mental health, it takes a while for people to get to the right treatment. Yeah. But the right treatment does exist. It is out there and it can change your life.
Fantastic. Well, Dr. McIngvale, thank you so much for your
Thank you.
time. We are very privileged to have spoken to you, and we look forward to future conversations.
100% same. Thank y'all for your work.
Thank you.